Yes, you can start.
Good morning, Mighty Champion team. Good morning, our viewers. Wherever you're watching us from, thank you for sharing your time with us. My name is NNAMANI Ebere Susan from Nigeria. I am clinical psychologist and nutrition coach. MCD is here for you. Like, share our video. You never know who will like it. You never know the life you are saving. MCD got your back. So every day we are here to support your mental well-being. Currently, they are running preventive and mental health education for teenagers. What a precious gift you can give to these young ones. You can reach out to this program on any of their social media handle, LinkedIn, Facebook, to explore more on how to help this young one in this critical stage of their life. So today, we are going to look at addiction, food, alcohol, and caffeine. There are three aspects of addiction. 1, abuse. 2, tolerance. 3, withdrawal. So abuse is simply psychological state of feeling something or wishing something, regardless of painful consequences, with or without dependent, while tolerance is your body diminished response to drug. After repeated use, progressive require high dose to achieve the same effect, while withdrawal symptom is physical or psychological symptom that occur when you stop or reduce these substances you have been dependent upon. But what is addiction? Addiction is simply a chronic relapsing brain disease characterized by compulsive drug use and drug use despite adverse consequences. So when you talk about addiction, you look at persistent desire. It takes time. It interferes with social activities. It's relapsing, denial, and name them. But addiction has also been implicated to craving, binging, and obesity. Today, globally, obesity is one of the major health challenge that is fast increasing. That in nearest future, the health system will be in problem because of obesity. And research have confirmed that 24% of these people of obese people are food addicts. So what is food addiction? Food addiction is simply eating behavior, show pattern of addictive behavior like excessive consumption, loss of control, craving. And the observation of these characteristics is based that high consumption of high fat, high sugar have the same similar effect like every other substances in your body, like every other substances such as alcohol or any other they have the same thing in your brain. But you may wonder that you have been hearing food addiction. Yes, food addiction, you cannot find this term in DSM-5. DSM-5 means Diagnostic Systematic Manual, the present edition 5. You cannot find this term. Neither can you find it in ICD-10 or 11. You cannot find it. But several research has confirmed that there is food addiction. According to American psychiatrist, Dr. Amen, he said, I want to know what is going on in the brain of overeaters. And he went to his lab and he discovered 5 types of overeaters. And these overeaters, he described them compulsive overeaters, impulsive overeaters, anxious overeaters, and sadness or emotional overeaters, or compulsive emotional impulsive compulsive overeaters. They are 5, but we're going to elaborate 4. Compulsive overeaters. He said that this type of people, their thoughts are stuck with food. They tend to be night eaters. They worry about food and they cannot sleep at night. He said that there's high activity in the frontal part of these people. And he said that there's this part of brain called anterior cingulate gyrus. He called that particular brain gear shifter. So he said that these particular people, they have single thoughts, and always what is in their mind is the food in the freezer, the food in the fridge. And he said that they have low serotonin. So because of that, they say that these particular people, they don't like taking coffee or any dietary pills, because this can make them overstimulated, and they reach out for wine in order to calm themselves down. So if you're in this category, what can you do? Support your serotonin. You can use supplementation, L-tryptophan, 5-HTP, or increase your protein diet, or increase your seeds, shea seed, pumpkin seed, almond seed. All these seeds have positive impact in your brain. What other type of overeater did he discover? He discovered anxious overeaters. He said that this type of people, that they have anxiety and nervousness. Because of that, they're always complaining about stomach problem, headache. Because he said that these particular people, they have high activity in their basal ganglia. So because they have high activity in their basal ganglia, their GABA will be low. So, GABA help a relaxation. So if their GABA is low, it makes them to be anxious, anxiety everywhere. So if you're in this category, what can you do? You support yourself with GABA. GABA help you to relax. You can supplement GABA or L-theanine, or you can do deep breathing exercise. Yes, deep breathing exercise. You can also do what we call hypnosis. You can do hypnosis. You can also supplement vitamin B6 and magnesium. So all these supplements help you to remain calm and feel fine. What other type of brain did he discover? He discovered another one called impulsive overeaters. These particular people are overly easily distracted as they reach food without thinking. So this type of people have low prefrontal cortex. Prefrontal cortex help in executive function and decision making. And he said that if you are suffering from ADHD, that you are at risk of being overweight, because this particular diagnosis, they don't stick with dietary plan. If you tell them what they will do, they will be doing what their brain is telling them. So if you're this kind of overeater, what can you do? You support your prefrontal cortex, high protein, low carb. Green tea, L-tyrosine is also good for you. And another type of overeater he discovered is sadness or emotional overeaters. He said that these particular people, when they are sad, they use food for comfort. So they use food to ease off their sadness, and they often feel depressed and low self-esteem. So he said that this kind of people, these sadness people, have high activity in their limbic system. Remember that limbic system So it's part of your emotion. So what can you do if you are in such category? Exercise. Do things that uplift your mood. Simple lifestyle changes. Hang out with good friends. Just distract yourself so that you, probably because you feel emotional down, that is why you're eating excessively. And you're eating excessively is actually affecting your overall health. So instead of you longing for food, find something that will distract you and support your dopamine. So what are the social implications of food addiction? Number one is that the social life of this individual is always being affected because they always have obsession of food all the time. They can't make friends, they don't make eye contact, a relationship are secondary. And at times they are overweight, their clothes cannot enter them. At times they steal people's food. Imagine this embarrassment. Also, they like hiding to eat in private so that nobody will see them. Do you see the implication of this food addiction? So why do we say that? So what can you do? Why do we crave? You know, for you to start having excessive eating or behaving this way, there must be something going on somewhere. And that's what we called ghrelin. It's called hunger hormone. This hunger hormone, they are peptides, they are found in the stomach. And because they are found in the stomach, they can stimulate the brain when you are hungry. It will increase your appetite. And immediately you eat, the brain will calm down. Or that is exactly how it happened to those who ingest alcohol. When the urge comes, if they don't take it, it will not go down. But what are the main reasons why we crave for this food or this substance, alcohol, nicotine, meth, and opiates? Why? Because the brain reward system, which is part of the brain reward system and its intricate network of neurotransmitter has been hijacked. And this neurotransmitter is very important for human survival. So people that use substance or alcohol also have the same urge to, that ghrelin also work in them. Because when the urge comes, it will rise and come down immediately they ingest this alcohol. So what other things can lead to this craving? Hormonal fluctuation. Hormonal fluctuation. If you're experiencing hormonal imbalance, both male and female, definitely your craving will be high. Also, what of if your own is not about neurochemistry, it's not about hormone, it's not about ghrelin, just like we have, that your own is spiritual aspect of addiction. You don't even know reason why you are having this craving, excessive craving. My advice is that there's what is recorded in Hebrew 4 verse 15 and 16. So we do not have a high priest who cannot sympathize with our weaknesses. So seek divine guidance, because food addiction is weaknesses. Yes, it's weakness. So seek out for divine guidance. When you seek out for divine guidance, it will help you. But if it is about neurotransmitter, remember that this neurotransmitter we are talking about is dopamine, serotonin, GABA, and endorphin. And when there is any low activity in any of these neurotransmitter, you will have poor judgment and poor decision, which will make you to start overeating yourself. which will make you to start overeating yourself. And that is why we see that food is a drug model. Yes, this theory proposed that the chronic overeaters can be a form of substance abuse. That if you look at their brain of those using alcohol, nicotine, that there's nothing different. They respond to their brain is the same thing. And there's several research that has confirmed that human beings have opiates, chemical opiates. This ingredient is what we found in cocaine, nicotine, and all that. The human being produce it. You might ask me how? By digestion of excessive sugar and fat. Excessive sugar and fat. So if you consume alcohol, if you abuse food, if you consume nicotine or meth or any of this, the same brain pathway is involved, and that is your reward system. That is why we say that yes, food is a drug model. So what can we do? What are these foods that we can be addicted to, if I may ask? We can be addicted to sweets. Yes, we can be addicted to caffeine. Yes, sweets, artificial food, processed meat, high carb, high fat, microwave popcorn. This particular one, you cannot resist the smell. When you perceive it, you must definitely look out for it wherever it is. So these are unhealthy food that can lead to addiction, food addiction. So even caffeine, some enjoy caffeine, but caffeine can be overstimulating your brain. Yes, caffeine can be overstimulating your brain. So if you like taking caffeine, what can you do? Just reduce 200 mg for pregnant women and 400 mg for non-pregnant women. But remember that you can be addicted to it. And there is implication for it too. As we're going to discuss now, what are the impacts of this alcohol, food addiction, caffeine? Number one is that alcohol can make you feel good for a moment time, but it can lead to brain dysregulation. It can impair your sleep. You cannot have what we call restorative sleep. That deep sleep that rebuilds the body, you cannot have it. Your digestive system will also be in problem. There's also withdrawal effects of the substance. Withdrawal effects, probably you'll be having hand shaking, or your body will be shaking, shivering, or all manner of physical or psychological symptoms is what is associated with this alcohol. Or any of these substances can lead you to psychiatric hospital. Yes, psychosis is real with this disorder, alcohol, cannabis, and other related disorders. So this can actually affect you. What of food addiction? It can lead to body shaming. It can still disrupt your gut, because when you over suppress your pancreas with so much insulin, it will stop working. And when it stop working, you know what it means? The craving will be higher every day and day. So what about caffeine? What could happen to caffeine? One is that it will do what we call rebound symptom. This one symptom is when you feel good immediately, you take it. After some time, you start feeling depressed, feeling anxiety, you be experiencing or mimicking what we call depression. You don't even know what you are feeling as a result of caffeine addiction. So if you find yourself in any of these things, what can you do? And what are the consequences of these actions? Let me first talk the consequences of these actions. We have learned the impact on your mental health. It can, number one, if it is food, if you are among the food overeaters, you can grow overweight, leading to diabetes too. It can lead to brain fog, irritable, you won't feel yourself again. So these are the basic. I don't want to mention all of them, but these are the basic. Diabetes, cancers, heart disease, irritable, foggy thinking, and all manner of bad consequences that associate with this use of these substances. So what can you do now that you have discovered that food, excessive food is a drug? It has the same pathways in your brain, all targeted your dopamine. So what can you do? Number one is keep your blood sugar level balanced. How do you keep your blood sugar level balanced? Eat high protein diet. I used to say that protein saves life. Protein is everything. It's a building block for almost all the neurotransmitters. So support yourself with good protein. Also, you can simply include nuts. Yes, some small nuts can help you and your water. Also, another thing you can do is reduce artificial sweeteners. You like sweet things. If it does not sweet good, you cannot eat it. Why? So reduce it both in your food condiments, both sweet and you know them. I don't just want to mention them, but you know those sweet things that you cannot stop laying your hand upon. Also, reduce stress. Stress can lead to high cortisol. Yes. So reduce your stress level. Also, another thing you can do, what are your triggers? What are those places that you went? Is it in the cinema? Is it in airport? Those places or in a social gathering? So I will not stop you from going to your cinema or going to your airport or mall. But what can you do? Since I know that these events trigger me to eat unhealthy food, I will plan meal, a healthy meal, eat it before going to that social event. I will have my water in my bag. I will have a small, while others are eating microwave popcorn, I can be eating my nuts. Yes, I can be eating my nuts. I can be drinking my water. Because these small things is supporting your brain so that your brain will have sufficient nutrients to reduce craving. Because both alcohol and food, all of them is craving. So what other things can you do? I have talked about supporting your blood sugar. 2, reduce artificial sweetener. 3, manage your stress. 4, check your environmental trigger. And the last one is detoxification. What of if you have been eating excessively and you're already overweight? You can start small, probably simple exercise. If you don't want to go to the gym, you can be walking around after it. Just 20 minutes or 10 minutes, walk around so that those food will enter where it's supposed to enter. You'll be walking around. Move around your compound. As you're doing, your body is rebalancing itself, okay? And use cinnamon is also very, very good. Cinnamon and cloves support blood sugar. Yes, just a shot in the morning can do wonders in your body. So detoxification is very, very important. So what are the recap of what we have done so far? Always know that excessive of everything is bad, whether food, alcohol is very, very bad. These substances you are taking, is it nicotine or is it all of them, you know them, can actually interfere your neurochemistry. So stop any of these substances. Some say that yes, a glass of wine is good for the heart, but you find out that some have using from one glass of wine and become alcohol addicts without them knowing. I wouldn't say you stop, but if you cannot put particular this one, you cannot put balance, stop it. Ask for divine help. Support your neurotransmitters. When your craving is down, there is no way this urge or craving will come. And I wouldn't want you to become obese so that you become part of those that will be a problem to the healthcare system. You see, in MCD, we are here to support your well-being, your mental health well-being every day through small, small life changes. At least today we have learned that excessive consumption of food have implication. It can affect our dopamine, serotonin, GABA, and endorphin. So we are here every day to support you, to give you small, small lifestyle changes that will support your well-being and protect you so that you enjoy life. Life is sweet. Yes, life is sweet. So that you can enjoy life. So thank you for joining us again. I don't know if you have any question or comments regarding what we have discussed so far. Your comment and your question is welcome. Thank you so much for listening. I appreciate your comments. Remember, addiction is real, caffeine is real, excessive consumption of food can have the same pathways in your brain. So always bear in mind that both high processed food, alcohol, caffeine targeted your dopamine. And this dopamine is your reward center, your brain reward center. So it's almost control your motivation, your pleasure, and everything. Both food, all of them control that. So protect your neurotransmitter, your dopamine is very, 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 very crucial for your overall well-being. Your comments, please, and questions.
Hi, this is Vardini.
If you have
You
any
said something
questions.
about cinnamon. How can you have it every day? A little or put it in water? What do you do? That cinnamon supports blood
Just
sugar?
you soak it in the water. Yes, what you do is you soak it in the water overnight and you can refrigerate it using shots. Be taking it last thing in the night is very good, or in the morning.
Thank you.
You're welcome. Please remember to like our video, share it. You never know who may need it. Okay. I would like to drop the last principle. The first one is listening to your body. The second one is read the label. So today's own is quality clean food. Quality clean food. When you eat clean food, there's no way toxins will have its way in your body. So when you eat clean food, you protect these neurotransmitters. And even if there's excess toxin, your body can have time to remove it from your body. So clean food will protect not only your brain, but your overall well-being. So what is in your plate? Is it clean, or is it full of high processed fat and high sugar? So clean food is very, 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 very. Always bear in mind. Principle 3, clean food. Quality clean food. Quality clean food is very, very essential for your overall well-being. Other comments? Any questions so far? So in absence of any other question and comments, I would like to appreciate all of you that have joined this live stream. Thank you for giving us your time. And we assure you in this MCD daily that you will not regret it, that we must do to make mental health everyday conversation. That is our goal. We want to make mental health issues everyday conversation. So if you have any questions or comments, you can drop. I will answer it when there's our call. For those that consistent here, I would like to share one of my lifestyle nutrition documents, simple lifestyle changes that will support. But I'll give it to those who share our video and like it. I'll give it to them free of charge. Okay, thank you so much. I appreciate. Do have a pleasant weekend. God bless you all.